You're listening to One Body, where we talk about health and science. I'm Cruzy. I'm a physician associate.
I'm Eden. I'm a speech-language pathologist.
You only get one body, so take care of it.
We're trying to have a good time, but we're not trying to waste your time.
Okay, let's get into it.
Okay, guys, welcome back. I'm joined by two pregnant ladies.
4 people are in here other than you.
Yeah, 5 total. The specialist guest is Nina, our sister, our friend. She's a mother, a content creator,
A mama.
a photographer, a
mama.
creative, a podcaster, a really good cook,
Apparently a great cook.
a pasta lover. She's Italian, and she's the best to be around. And today we're going to interview her and get her insights on ADHD and just life in general.
I'm so excited.
Yeah, welcome. Thanks for
Thank
having
you.
us to your house.
Yes.
In this beautiful podcast studio. Tell us what you've been up to, what's getting you excited these days.
Okay. I am officially 16 weeks pregnant with my
Woo!
4th baby. And apparently it's a boy. Apparently, I was not convinced. I really, really thought that it was a girl. And we did a sneak peek blood test.
Mm-hmm.
And it came back that it was a boy. And I really was so shocked. So I am just needing to confirm that on the ultrasound because I'm like, are we sure? This
Part of
pregnancy?
you is still like, maybe it's wrong.
I mean, possibly.
Mm-hmm. But
I
what are the
just-
odds? Could it be wrong?
I mean, I think it's like a really small percentage that it could be wrong. It's probably a boy, but I was hoping for a boy, so I'm excited. But I really, really, really thought that it was a girl just based on how the pregnancy has been thus far.
As in dry heaving every second.
Yeah. I feel like just within the past couple weeks, I've started to feel human again, which has been such a relief. Oh my goodness.
The best thing was Nina told me that she was making her lunch one day. She's like, yeah, it's a baking sheet covered in beige foods, tater tots,
Bagel bites,
What's the third one?
chicken nuggets.
And chicken nuggets. And I was like, yum.
It was all one color
Yeah.
for sure. Yeah. So we found out we were pregnant at the very beginning of the year. We set our goals for the year, vision cast. And then I found out I was pregnant. And so I was like, oh, okay, that literally changes everything, which is totally fine. But then I started to get really sick and just had a really rough first trimester. And it wasn't until recently that I have started to come out of that. So I have not really been crazy busy with much other than growing a baby.
Yeah. Surviving
For sure.
We asked Ava's their oldest, and we were like, how's your mom doing? She was like, oh, so much better. Gosh. We were like, oh,
Yeah, it's
thanks.
fair. Yeah.
Yeah, that was rough.
Yeah.
Okay, good.
Y'all,
But you
it's-
look like yourself. You sound like yourself.
Thanks. I really feel good. By between 3 and 5 p.m., I hit a wall where I'm literally like, I need to take a nap.
Yes.
I need a nap or I need something like a
Yeah.
crispy Coke.
Well, we have 45 minutes till 3, so
Okay.
We've got
You
it.
got me.
We
I
you
drink
for
no, I
little
drank
bit.
a Coke.
Oh,
We're good.
yes.
That'll get her through. What's a new hobby that you've recently gotten into or that's resurfaced?
I would say over the past 2 years, I started getting into reading. I got a Kindle, and that really changed the reading game for me. And then since I've been sick, I was experiencing so much nausea triggered by being on electronics.
What?
Not my Kindle though. Yeah. So I was not scrolling. I was scrolling very minimal. I would get on my phone and then I would get nauseous and I was just like, no. So I started reading again and I just started reading ACOTAR series.
Oh, yeah.
I think I passed
Fantasy
you.
girl.
Yeah, I think I.
Yeah, you're done, right?
I am on the 5th book.
Wait, I'm on the 5th book.
You started the 5th?
No, but I'm about to.
Okay.
Let's see who gets it first.
I just started, but I also just synced with Audible. So I'll read at night or whenever I have the time, usually after my kids go to bed, or when I'm in the car by myself or something, I'll listen to Audible. So it will pick up where I left off reading, which is nice. I kind of toggle back and forth between the two. Although I will say, I feel like Audible was very humbling for me in my pronunciation of all the characters' names.
Okay, how do they say Feyre?
Feyre.
Feyre. Okay,
Yeah.
so I had that right.
Yeah.
And then the other one is Cassian.
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 Yep.
Okay.
Yep. And
Interesting.
Rhysand.
I was saying Rysand.
I was always saying Rise and Rysand.
Rhysand?
Rhysand, aka Reese. Yeah, I
No.
know. I
He's a
know. That's
girl.
what I said.
I don't like it.
I was like, no, I feel like Rise is like sexier.
Way sexier. Also, I don't know about you, but whenever she's getting into an intimate scene, I'll put it that way, which is very frequently, the wings, are they weirding you out? I'm like, what are these wings doing?
Okay. Yes, but I feel like, and I don't know if this is your Instagram feed yet.
No.
My explore page is all AI simulations of like the characters. And it's so good. I need to just let you scroll my explore page so you can have a visual for how other people are envisioning the characters and the wings.
Because in my head, it kind of makes it less like relatable, obviously, because I've never like had wings involved. But it's crazy. They're like swooping over them. It's weird.
It's like a whole circle.
It's a thing. Like they're involved.
But the wings are also like very sensitive.
Very. Yeah, it's like I kind of hate it, but okay.
Yeah. I need to get on. I'm not in that world, so maybe one day. I did read Fourth Wing.
Fourth Wing was great.
So good.
Yeah. Almost better, honestly. You don't think so? I think the wings are throwing me off.
I think the wings are throwing me off. I don't even know.
Okay, but Reese can like make his disappear.
I hate that you're calling him Reese right now. Get a little closer.
Tell us something that most people don't know about you or would be surprised to know about you.
Okay, if you haven't met me, I think that people are typically surprised that I'm short. I guess I give tall girl energy. I don't feel that.
5'3".
3 3/4.
Okay, I was gonna say 5'4".
Yeah, I'm a glorified 5'4". So I'm short. I am left-handed.
So cool.
But I am also right-handed. There's a special name for it. It's not that.
Nope.
It's something else.
I can never remember it.
It's not ambidextrous?
No, because somebody explained that ambidextrous is like you're like equal in both sides. And I don't know how accurate that is, but this is like I forget the term for it. But
special.
I know, I'm just a special girl. I write with my left hand. I eat with my left hand. I throw with my right hand.
Weird.
If I'm going to punch someone, it's going to be with my right hand.
Have you ever punched someone?
No, not for real.
I don't believe it.
Actually, I don't believe that.
I mean, I've like punched Hudson, but not in like, abusive way. Yeah.
In a cute way.
Yeah.
Okay. How has it been managing motherhood and taking care of the home? You're about to have 4 babies with all of your passions and content creating and, photography, all your other hobbies.
Yeah. It's been hard. It's definitely been a lot of trial and error, I would say. When we moved back from LA, I had this vision to start a photography business, but I had always kind of been dabbling with social media because I just love creating content and capturing moments of my life and sharing that. I thought was really sweet and fun, like such a cool way to document our lives and be able to look back. So that was always kind of my motivation for doing social media. And then I love acting. I love being on camera, I think is so fun. So it just kind of always came naturally. But when we moved back to Chattanooga, I had a vision to start a photography company because we were pregnant with our second. And I was like, I think this is something that I can do that will be like a good creative outlet for me while kind of figuring out motherhood in a new way with our little boy being back in Chattanooga. And so I think I started that business when he was 4 months old.
Wow.
Yeah, he was little nugget. It was just part-time. And I was just so thankful for all the clients that I got to work with during that time, anybody that trusted me when you're just starting a business. So grateful for the people that trusted me when I was just starting out. But I did a lot of my editing during nap times and after my kids would go to bed. And I did that for so many years. And it was exhausting because my business grew and then I continued to do social media kind of in the background always, but photography was my main priority. And then I feel like at some point it kind of shifted to where I realized, okay, there's way more flexibility with social media. And I feel like it's more lucrative in terms of my time investment. Um, and so it was really scary to be like, okay, I've worked so hard to get my photography business to where it's at, but I feel like God is really just keeps opening the door for me with social media. So deciding to kind of allow myself to pursue things that may feel a little scarier, but may at the end of the day cause less stress and allow me to be more present at home has been huge, which I'm sure you can relate with your job. I'm sure you will once you have kids.
Yeah.
Just navigating like, okay, I think this is good for me. I want to continue doing what I've worked really hard and like invested. It's like this is a part of myself that I have invested a lot in and I love, but I also love being a mom. So like how do I juggle both? I don't know if that answers your question fully, but
Totally. Yeah. No, I think I've experienced it because I work part-time and I have
Mhm.
one baby and one on the way. And I think working part-time is such a gift. And I'm so thankful that financially we can do that.
Mm.
But I do feel constantly torn in both directions. And like I'm not able to fully give myself as much as I want to in both
Yeah.
ways. Like
Mhm.
I want to spend every single moment with Palmer. I love her so
Yeah.
much. I don't want to miss a second.
Mhm.
But for me to show up well for her, I do think it's good for me to have some other things that I'm like
Yeah.
engaging in and, using my brain in a different way and yeah, staying sharp in medicine, which I worked really hard to learn. But then at work, I do feel like I am not to the same caliber that I was before I had
Yeah.
babies because I just can't be. I have to
You
have
like
boundaries.
you like lose half your brain in
You lose
childbirth
half your
anyways.
brain. It's always foggy.
You birth it with the baby.
Yes. Yeah, it's
And I'm like,
crazy.
you're not in a bad way, but like a part of you is like
Yeah.
you're kind of like there's parts of you out there in the
Yeah.
world.
Yes.
I
Yeah.
also think photography is a little bit misleading for any future photographers or aspiring photographers. There's a lot of flexibility, but I know you've shared before, like editing at night when that's your time with your spouse or your alone time or
Mhm.
away on a Saturday night shooting a wedding or like it's
A
not,
whole
there's a lot
day,
of
a whole
flexibility,
Saturday. Yeah.
but there's an opportunity cost with anything that you're doing.
Yeah.
I think you're handling it really well. I think it's impressive how
Thanks.
much you've grown, like you've really created and scaled a business. And I think it's impressive to also learn how to make it sustainable for you, for your family. And
Thank you.
We're going to pivot. We're talking today about ADHD, which is attention deficit hyperactivity. Attention deficit hyperactivity disorder, ADHD. We all know someone who has it. I do think it is becoming more prevalent. And I think
It's like so trendy and cool now.
so cool, guys. Everyone
you don't
should have
have
it. No, I think COVID was a big inciting event for a lot of people to have all kinds of mental and cognitive things come up. So Nina was recently diagnosed, and we thought it would be really interesting to just go through your experience with it and see if people can relate. I wanted to give just briefly what is ADHD. Probably everyone's familiar with it and has seen kind of how it presents in kids, but there's a lot of different subtypes. It can present very differently adolescence and adulthood. You can be diagnosed at any point in your life, but it's basically a neurocognitive disorder where the dopamine and the norepinephrine pathways are dysregulated, and it impacts this frontal cortex, which is kind of like behind your forehead. So it involves like working memory, so trying to plan your day, remember what needs to be done, organization of tasks, staying focused, and then executive functioning is kind of like that higher level, like impulse control, problem solving, all of that stuff. So it can look very differently depending on your season of life. It's diagnosed typically by some sort of psychiatrist or like an NP or a PA that works in psychiatry. Basically, you fill out a long form going through tons of questions about how you navigate different tasks, how your brain works. And then once you're diagnosed, you can talk about treatment options. Typically, it's a combination of lifestyle changes and behavior changes, medication. So, the most commonly that would be stimulants like amphetamines or methylphenidate. There's also one called atomoxetine, and then bupropion is Wellbutrin. Those all are common and work very, very well. And then also cognitive behavioral therapy, executive functioning, like CBT/EF, is the type of therapy that maybe your therapist would work with you to like help you change some habits and just help basically figure out what are the pain points in your life that you can work to improve. So we want to talk about your experience specifically.
Okay.
So I want to know your experience with getting diagnosed as an adult. What was that like? And then what was it like starting treatment as well?
Okay. Well, I had been in therapy, just regular therapy, for over a year. And I kept feeling really down on myself because life circumstances were always different. I could be experiencing great things in my life, and I still would just go into therapy what felt like every other week. Like, why am I so down? Like, my life is great. What's wrong with me? And we would work on all these things. And I was like, am I just a manic depressive person? Like, I feel like this has kind of been a struggle that I've honestly dealt with my entire life for as long as I can remember, going back to high school, maybe middle school. And so it got to the point in my therapy where my therapist was like, hey, maybe you could benefit from going and getting a psych evaluation because there could be something off with the, what is it?
Neurotransmitters.
Yeah, in your brain. Like, you know,
Because at that point, had you already been taking medicine for depression?
I had tried Lexapro. I had weird side effects. The risk was not worth the reward to me specifically. And so that scared me. So I stopped taking it and I never really got back on another one. Because at that point, when I started taking Lexapro, I was not working with a psychiatrist. So I was like, okay, I'm open to like actually seeing someone who can work with me and say, hey, you didn't have a good experience with Lexapro, but maybe here's another option that might be, a better fit for you. So I was going into this psych evaluation, honestly feeling a little nervous. And I was fully anticipating them to just be like, yeah, you're depressed. Like, I already knew that. But like, let's just medicate you and you'll go on about your day. And so going in after taking literally forever, this is an indicator, I feel. How long does it take you to sit down and fill out the actual evaluation form? Should be an indicator.
Like the first question that's not listed.
In and of itself, yeah. How long have you put this off? How many times have you tried to attempt filling this out? So then going in and actually sitting down with the psychiatrist and just kind of walking her through my days, my years, my traumas, all these things kind of in a nutshell. She says, I really think that you have ADHD. And I'm like, what? Like, what? I really was so, I think, just ignorant. My understanding of ADHD is the hyperactive kid in school. in like middle school that needs to be medicated because they can't sit still. I'm like, what do you mean? Like, I don't know really anything about ADHD in adulthood. That had never occurred to me what an undiagnosed ADHD mom of 3, like what would my daily struggles look like? And so I asked her that. I was like, can you like tell me more? And she went on to say, like, I imagine this is what your day would look like. And so she kind of painted this picture of my day without me prompting her. I imagine that you wake up and you feel X, Y, or Z. You wake up and you feel tired, even though you slept super well. You got a great night of sleep, and then you're going and you're getting your kids ready and you're experiencing easy overwhelm throughout your day. You're fatigued, you're burnt out, like having these moments of like emotional flooding and feeling overstimulated, and it causes you to react this way. You probably are someone that procrastinates. You probably have a lot of things on your list of things that you need to get done in a day, and it's hard for you to even check one of those off because you are so distracted. And then you feel paralyzed. And you're like, where do I begin? And then you get down on yourself because you're like, what's wrong with me? Am I just lazy? Why am I tired all the time? Why is it taking me 3 hours to start to fold a pile of laundry? And then why do I feel like I need to take a nap after I finish? It's like, and so she just was explaining this to T, and I just felt like, have you been reading my chat GPT? Like, did they give you access? How do you know all this
She's
about
like
me?
the progressive lady who's like in the house in the back.
Yeah.
Literally, yeah. I'm like, how do you know all this about me? So that was really shocking. And honestly, I just felt so seen, and I felt really hopeful. I think going in thinking, oh, you're just a depressed person, but leaving realizing, oh, you're at a higher risk to struggle with depression if you have ADHD.
Yes.
And that I think a lot of the things that I had been going through and experiencing were triggering depression for me because of my undiagnosed ADHD. And so I felt hopeful. Like, I don't know what that means. But like, if there's something that you can do to help me, that'd be awesome. So that was kind of my path. Sorry, that was long-winded.
No, that's so helpful because you gave us kind of what it looked like for you, which I'm sure is relatable for a lot of people. But it's your level of everything that you're experiencing is like steps higher or like more extreme than just your typical like tired mom who has too much to do in a day. The humps you have to get over to get something done or to organize your day or whatever, that's so much harder because of the way your brain is hardwired or the neurotransmitters are not functioning properly.
Yeah.
Or in the right doses. Like that's the difference, and it's probably relatable to a lot of people. But I want to know, like, you ended up getting onto medicine. What did you notice that changed? Have you had a positive experience?
Yeah. Okay. So I started on Vyvanse, and the first day that I took it, I just wanted to cry so many times throughout the day because I felt like it just got me over the hump of starting all the things that I have been wanting to do that I have just not been able to do. I started taking Vyvanse, and the same day I joined a workout place. It's literally called The Workout. It's a Pilates.
Shout out.
Yeah. Pilates club. What do you call it?
Yeah. Club.
Club?
Studio.
It's definitely a club.
Studio.
Pilates studio.
Yeah, it is a club though, for
Club.
sure. Like a cult.
Yeah. Club cult
Yeah.
studio.
We love it.
But yeah, I literally joined a Pilates studio the same day and was like, I'm a workout girl now. And like, I cannot tell you, I cannot explain how that has literally never been the case for me. Like, wanting to work out and having the desire, yeah, but like getting myself there, it felt impossible. I started taking Vyvanse, and I was like, I'm not stuck. I'm like, my brain isn't keeping me stuck, if that makes sense. Something's like silly. I think I don't know if you can explain this better, but with ADHD, something with your dopamine is different. So, like for me, if I'm like, okay, I need to do my laundry that's been piling and piling and piling and piling. Okay, well, I have to give myself a reward
Yeah.
before I start because I need the reward to get me through the task. And so I should go get a Starbucks drink before
An hour later.
I'm doing my laundry today, so I need to go get a Starbucks drink that's gonna give me a dopamine hit so that I can start the task.
Yeah.
But also I have to have something else that's entertaining me while I'm doing the task. So I have to like have a TV show going that is entertaining me while I do the task. Yeah, that's one way that I didn't have to do that after I took Vyvanse. I was just like, okay, this literally changed my life. I just had multiple moments throughout my day on that first day that I took it where I just wanted to cry because I was
joy.
like, yes.
Yeah. Or
Like-
feeling like seen.
I was just like, this is what it feels like to feel normal, like to not have so much noise in my brain.
Yeah.
I don't know how else to explain
I
it.
resonate with the like, what's wrong with me? Or why can't I blank? And like, we know that comparison isn't helpful ever. But I think especially when you can compare yourself to people in the same season as you or same amount of kids or also working part-time or managing something. And it's like, well, they can do it. Like, what's wrong with me? And all of our brains are functioning differently. But especially you think about like a neurodiverse or a brain that is truly functioning differently.
Yeah.
There's different expectations. There's different levels of support required to like meet these same standards. I'm not diagnosed with ADHD, but I resonate with a lot of the ADHD symptoms. And I'm reading a book that used the term fuddled, and it's been
Fuddled.
like F being fuddled is my new tagline.
Fuddled
It
in the
says,
brain.
to be fuddled, neither doing what you ought to do nor what you like. So it's kind of this like the stuck feeling. Like I'm stuck. Like it's this almost like paralysis of knowing all the things you need to do and not knowing how to get started. And then I feel like once I get started, I do need like other things to keep me stimulated, but I'm kind of unstoppable. But it's really, really hard to get started.
Yeah.
So I think that's helpful. I'm curious to hear if you can remember or reflect on like you mentioned some of high school, middle school, but like through the lifespan for anyone that maybe also thought ADHD was this really certain middle school child or something. Can you remember moments looking back of like, oh, that makes so much more sense through the lens of an ADHD diagnosis?
Yeah. I mean, I even in terms of reading, like I remember being in high school and struggling so badly with academics because I remember I would sit down and have to read in a textbook and I would read the same line over and over and over again. Like, why can I not comprehend? I know how to read, but what is like actually, what is this actually saying? I struggled so badly just being able to comprehend and focus. I think if I had been diagnosed sooner, that would have really helped me. I remember as a high schooler sleeping a lot.
Yeah.
Sleeping all the time. Like I was always tired, and any study hall that I would have, I would lay down and I would sleep. And I think I was struggling with depression a lot throughout high school, middle school. It's just tough times. But I think a lot of it was just probably triggered out besides the chaos of my personal life, triggered by just constantly feeling like a failure with academics because I just struggled. And I think that if I had had maybe a little bit of the help that I needed, maybe I wouldn't have struggled the way that I did, sadly.
Yeah. And then you like have this label that you put on yourself of like, I guess I'm just not really like
I
a good
guess I'm just
student. I'm
like
not really
a stupid girl.
Yeah,
No, I remember feeling that way. Like all my friends were really smart and did really well. And I just remember being like, I guess I'm the stupid one in the group, which is so sad. I'm not stupid.
Yeah.
I'm really not. And I did way better in college, which I don't know how.
People with ADHD are, on average, compared to their neurotypical peers, more likely to struggle in school. So their grades likely aren't as good. They're more likely to get in a car accident,
Mm.
and they are less likely to make the same amount of money as their peers.
Good.
It's
Oh,
roadblocks.
shoot.
Like no, I'm saying like
Yeah.
it's legit.
I
Like
mean, like,
it's
Yeah.
putting roadblocks in the way of you being able to just function and do what you need to do.
yeah.
So
How many ADHD people end up working for themselves?
that's a great question.
I'm
I
curious.
honestly would not think that many
Really?
because you
Because
have
you
to
have
be
no
really
external
driven.
like catalyst. Like
Yeah.
you're the only thing.
Oh,
For
yeah.
better or for worse.
Yeah, that's true.
You have to be really self-motivated to work for yourself. So you gotta like,
But maybe you can
Yeah.
accommodate, like if you really know yourself and know the supports you need and the schedule that like you can work the best with, then it's maybe helpful. But
Yeah.
personally, like, oh my gosh, left alone for like a
Can't
day
be
is
can't be
really bad. Yeah, I
trusted.
can't be trusted.
Well, crunch time. That's like when I would perform is like I would never study before a test. Like days before, I would wait until the night of I'm writing a paper. I'm starting my paper the night before. Like crunch time, procrastination. Like that is when I would get my stuff done. And it's
Yeah.
still to this day, I feel like I wait until the last minute.
you need the adrenaline to get you
Yeah.
to do it.
Yes.
And let me also just preface, those things I just mentioned are for non-treated
Yeah.
ADHD. So that's
Mhm.
where like treatment is so important because
Yeah.
you see the roadblocks that you can take away
Yeah.
when they have the tools they
Yeah. And I don't drink, isn't coffee a stimulant?
need. Mhm.
I don't drink coffee and I've never drank coffee. So, or caffeine really. So I never really knew like what it felt like to be, I guess.
Mhm.
Yeah.
Do we know why you're more prone to depression if you have ADHD?
But I think it's just because of what you're explaining. Like it makes you feel like failures in
Yeah.
ways.
I think
It
that's
makes you
it.
feel like you can't function at the level of your peers. So you feel like, what's wrong with me? And that's
Mhm.
depressing.
Mhm.
Yeah.
I
If
think
you're
that was it.
stuck, like if you don't have the tools to get out of it yourself,
Mhm.
then it's just a
Also, it really, really, I mean, if you have ADHD, I'm sure you can validate this, Cruzy. Rejection sensitivity is a big symptom contributing factor to some people with ADHD. So dealing with that and then also emotional regulation is like very, what is that? When you have ADHD undiagnosed, I feel
Mm.
like regulating your emotions is very, very difficult. So, yeah, you feel very quick to anger, really easily overstimulated, overwhelmed, flooded faster, I feel like, than someone without ADHD.
And you're also a 4 on the Enneagram, so you feel
Yeah.
things very deeply already.
hmm
So that in combination is probably hard.
Yeah. When I am like not in a good place, I'm like, oh, I'm like gonna die.
Yeah.
Yeah.
and you're a woman whose like
Yeah.
hormones change, so
Yeah.
that's something to
Yeah.
consider.
And I'm
as well.
pregnant and
Yeah.
like, what's happening?
Yeah.
But you're a good example of like even without the medication, it sounds like it's been challenging, but you've accomplished a lot. Like it didn't stop you in a lot of areas. And then
Oh, yeah. I
now-
got so far without it.
yeah.
But
Like
then I found it and I'm like, wow.
look, yeah, you're unstoppable now. Like watch out.
Or I was, but I'm not medicated right now. So what's happening?
Yeah, should we talk about that?
Yes, quickly just to finish up, like starting the medicine, it sounds like you had a pretty good experience with it.
Yeah.
Some people may not. They may have unwanted side effects. I think the main side effects long term from taking a stimulant would be it raises your heart rate and your blood pressure by like 5 points each.
Mhm.
And then it can interfere with your sleep. It can make you jittery.
Mhm.
Sometimes
Yeah, I
like
experienced
anxious.
all that.
Okay. Okay, but overall, you had a positive
And it
experience.
curbs your appetite.
Curbs, yes. So
Mhm.
you might lose weight.
And you might get dehydrated. You like have to, yeah, you have to just be aware of all of those things and be really
Cognizant.
yeah, to remind yourself to drink water and
Dang.
eat.
Don't
Mhm.
die.
Don't die.
Okay, but I want to know, were there any unwanted or like negative side effects of the Vyvanse?
Definitely, there were moments. Okay, first thing that I noticed is I started on the absolute lowest dose. I think that some people recommend starting on 30 milligrams. Some people start on 20. I started on 20, which is very low. And it was great until one day I felt like, okay, I feel like it's not working. I feel like I might need to up my dose. And for me, I was really trying to not take it every day. I would try to take it on the days where I knew I needed to be productive and then give myself a break on the days where I don't, I'm just like typically the weekends, like my husband's home, we're like working together with the kids. I don't have a lot going on unless I was like shooting a wedding or something because I really didn't want to feel dependent on it. But yeah, I did not like the feeling of like, oh, I need to up my dose because how,
Tolerance.
yeah, like how I thought if I wasn't taking it every day, then that would prolong me having to up my dose. And I think it did. But yeah, I did not like the feeling of like, oh, am I just going to have to keep upping my dose for as long as I take this?
Yeah.
Because when I did eventually up my dose to 30, 30 is the highest that I ever went, it did start to affect my sleep. So I wouldn't have any issues falling asleep, but then I would wake up at like 3 a.m. and I would just be laying there like with my eyes open, like not able to go back to sleep. I feel like there's still such a stigma around like medication and like being medicated. And that has always been my like hesitancy with even just getting help to begin with. But I do think all of those things ended up helping me.
Yeah.
I'd say that in the past because I'm not currently on any of those things. So,
Yeah, that's a great transition, Nina. You're pregnant. Congratulations.
Thank you.
Weren't necessarily expecting to be pregnant, like you mentioned.
Yeah.
So with that, like, had to unexpectedly and abruptly get off of a lot of medication. Tell us a little bit about like your thought process behind that. I don't know if you had counsel about like getting on or staying on or getting off, and how that's impacted you.
I found out that I was pregnant, and truly, one of my first thoughts was, I don't think I can take my medication. So I got on Chat GPT.
Of course.
Chat, tell me, do I have to stop? And Chat said yes, but also said, talk to your doctor. So I immediately text my psychiatrist and I'm like, hey, I just found out that I'm pregnant. Am I able to take these? And she ends up telling me, like, basically, no. The medications that I was taking, aside from Wellbutrin, the risk is that they just haven't been studied. It hasn't been studied enough to be able to say whether or not it's safe. So obviously you want to err on the side of being safe and cautious. And so if you can stop taking them, stop. Obviously, we do know that stress really has a huge impact on the baby and depression, all those things. And so if you feel like you need to take the medication because you can't cope, then it's worth the risk, essentially, is what they will tell you.
And it's what is called shared decision making in medicine, which is it's exactly what you did. It's a conversation with your provider about risk versus benefit and what both parties are most comfortable with. So I think you took the information you were given and decided, like, I think I can try to manage without it for the sake of my baby. But
well, I just didn't know what I didn't know. I wasn't willing to take the risk. I was willing to cut the medication and let's see how it goes. But I didn't know how that was going to impact me and until I was like really in the thick of it. And I think stopping those medications cold turkey on top of being on the forefront of a horrible first trimester with nausea and exhaustion was so hard. I was not anticipating how difficult that would be. And it was really, really rough. It was actually, if this is any insight, my daughter is 14 years old. And the first day that I stopped taking my medication, she came home from school and she could tell a difference in me. Like my nausea and everything hadn't even started kicking in yet, but I was so tired. That's like one of my biggest struggles with not being on medication is like, I just feel so tired. I'm so tired. Why am I so tired? So that, and then you're pregnant and like all of your energy is going towards making the baby. My daughter came home from school and she's looking at me and she's like, Mom, did you take did you take your Vyvanse today?
Oh my gosh.
And I'm like, no.
Sure didn't.
And she's like, why?
Hey,
And
Brenna.
and I'm like, I don't know. I didn't take it today. And she's like, okay. And so
She
then,
knew.
so she didn't know yet. So then the next day, she comes home from school. Mom, did you take your medication today? No. No, I did not. She's like, huh, okay. About a week goes by, and she finally confronts me. She's like, why are you not taking your medication? The contrast of like who you were and who you are right now. She didn't know I was pregnant yet. We did not tell her until we were far enough along to know that it was viable. And so I was just like not wanting to tell her, but what am I supposed to say? Why are you not taking your medication? She literally was like, why are you not taking your medication? It's better for everyone when you
Please.
take your
Wow.
medication. I'm like, oh great, I am the crazy mom. A
Oh.
mom's off her meds. Yeah.
It's like, everyone watch out.
So then this chick gets on Google or chat, I don't know. Hey Google, why is my mom not taking her Vyvanse? Why would my mom's doctor tell her that she can't take her Vyvanse? And so then she confronts Hudson and she's like, Dad, is mom pregnant?
I wonder why she went to him.
I know.
Like, she's scared.
Because she's scared of me. I was a monster. Y'all, it's like if I was out of bed, then I was like actually a zombie. I don't know. It
Crawling to
like,
get
"Oh, she's out.
your tater tots.
Everyone.
Yeah. Yeah, it was rough. It was rough. I had days where I was like, I can't get out of bed. I can't get out of bed.
Because for all of your medications, it's recommended to wean. Like, is there a pretty
I don't know.
regimented?
Chrissy, what'd you say?
Yes.
Yes.
Like slow titration off of
Yeah.
stimulants is what's recommended so you don't crash.
I crashed. I
Yeah.
burned.
But you didn't have a choice. I mean,
yeah.
you did what you had to do. And I think that the combination of cold turkey, stopping stimulants, getting into the first trimester.
Off my antidepressant.
Yeah.
Like,
it's
aren't
not
those
like-
different parts of your brain too?
Yes. That's hard.
Yeah. It's not
Yeah.
like you were like anticipating getting pregnant and knowing, okay, when we get pregnant, like I'm gonna stop. Like we're prepared.
Yeah.
Let's block this off on our calendar. It's like no, life keeps going. Your kids are still needing you. They're
Yes.
still like days
Yeah.
aren't the same for them. Your day
Yeah.
just looks completely different.
Yeah.
It feels completely different.
Mm-hmm. I feel like if you are wanting to get pregnant, if you are currently like, oh, maybe I have ADHD, this resonates, this sounds like me, I want to go get tested, I want to get medicated, whatever, but you're also like, I want to be pregnant, I just would advise you to give yourself time to wean off and do not do what I did because it was really, really bad. I would not. I don't know. I mean, by the grace of God carried me through that I would say it took me about a month. Just the crash feeling that I really felt was really a lot. And then it was like, okay, I feel like I'm past that, but now I'm just like throwing up all the time.
Yeah. Gosh. Yeah. You have been through it.
Yeah.
Okay. So medicine is not something you're doing right now.
Mm-mm.
Are there other things that seem to be helping now that you're kind of out of the throes of first trimester? Habit changes, behaviors, like ways you structured your day that help you?
Good question. I feel like sleep is important. So something that I have noticed is like if I don't get good sleep, then that really affects my mood throughout the day and like my ability to self-regulate.
Yeah.
I'm struggling. I'm doing my best, but identifying certain triggers for me, the things that I'm struggling with the most right now being unmedicated aside from the exhaustion that I feel, which is like hard to differentiate, like how much of this is pregnancy related versus ADHD, is like that motivation, like how, I have all these things I need to do, feel like a failure because I'm like not able to check these things off my list. I'm really just trying to give myself grace and be realistic. Like, you're pregnant.
Yeah.
You've got 3 other kids at home that you're tending to. It's okay if you don't get your laundry done today. That's okay. Unless you have no clean underwear, then like get your laundry done.
Not okay.
And that's not good.
They're your undies.
Yeah. So I'm just trying to like be more gracious and honestly set, I guess, more realistic goals for myself to achieve in the week. Instead of having a huge long list of things that I need to do every day, I'm like, just give yourself one task. Do what you need to do to get it done. And honestly, this is I don't know. I don't know how this is gonna sound, but I kind of am in the mindset. I'm like, you're pregnant. You need a Starbucks drink to get you through this laundry. Go get the Starbucks drink. Your baby needs that. So I think I don't know. I think I'm just really trying to be gracious towards myself, be realistic with the goals that I set. Reading before bed has helped me. So I read on my Kindle until it literally puts me to sleep.
Yeah.
And that has been really helpful because when I do that, I feel like I sleep deeper. Really like turns my brain off in a way that probably scrolling on my phone does not.
Right.
And then last, I would say, is identifying the things that are triggering me and just trying to honestly remove myself. I have a teenager. I love you, Ava, but it's hard. My hormones and her hormones, and we're like hormoning together. I'm like, okay, I just need to take a step outside.
Yeah.
Because I'm not able to self-regulate in this moment, and that's not good for me, and that's not good for you. So I'm trying to just be like, okay, go take a breather, step outside, do whatever you need to do, take a nap if you need to. I'm hoping that now that I'm in my second trimester and I feel like I'm getting my energy back and I'm not throwing up all the time, that like being more active will be good for me, but I haven't gotten there yet. It's on my list.
Yeah. One of the things on your list.
Yeah.
I know for me, this is, again, I don't have ADHD diagnosed, but I have to set timers for everything. So
I've not done that.
I have a timer for when I start getting ready for bed. I have a timer for when I should be like in bed, like an alarm. It goes off on my phone.
How do you know how long to set it?
Well, I try to go to bed at the same time every day. So it goes off at 9:30, and that's my key to like start getting ready for bed. It sounds crazy that I can't just watch the clock on my own.
No, it doesn't sound crazy.
But I absolutely cannot.
Yeah.
So it's like, okay, and sometimes I'll do a 9:15, so I have 15 minutes.
Oh, that's nice. You're like loving yourself in that way.
I
Yeah.
also will open my maps an hour before I need to leave. And so it shows my ETA. So it's like, okay, I need to start getting ready. Like, it's really hard for me to figure out.
Share these tips with Hudson.
Yeah, I have.
Okay.
And then, yeah, I just think timers, like visual reminders. I work with a lot of kids with ADHD, and a lot of like executive functioning therapy is pretty simple stuff, but it's like compensatory tools or strategies to support you. So it's nothing crazy.
Yeah.
It's like things around your house that can help, or placement of things, that it's a visual reminder, or having stuff at your bedside that's like your medicine at your bedside.
Yeah.
You're not going to forget to take it.
Yeah, I do have my thyroid medicine. It's right by my bed, so I'll remember to take it every morning.
But it's like, it sounds simple, but it's really hard to think of those things for yourself sometimes.
Yeah.
And it's been really helpful for me. I'm trying to be better at time management, which is another big piece of.
I need to try that.
Yeah.
I need to try that for sure.
Okay, those behavior changes that you mentioned are very helpful and realistic, I think, for people. I wanted to just go over, kind of in that same vein, more of like a functional medicine approach that some people may want to incorporate.
Share.
Okay, well,
Yes.
it's stuff that you're already doing. So you're already doing it.
No beige foods.
No beige foods, honestly. Okay, so the first thing any functional approach is diet's gonna be like step one. But the thing about making any changes in your life as someone who does have ADHD is you might need the medicine and the stimulation to get your brain hardwired in a way where you can actually make changes.
Yeah, no, I felt
it doesn't feel too overwhelming.
Mm-hmm.
You can't just expect yourself to like start out in a functional medicine way and like make all these amazing lifestyle
That's
changes.
one thing I did not mention, and I feel like I should mention that really quick.
Yeah.
We kind of talked a lot about this over my journey with it, but I have thyroid issues. That's a whole separate thing. We can get into that another time. But one of the things that my doctor recommended was cutting gluten from my diet.
Which
and
felt like
So sad.
impossible.
There's no way.
Impossible. That is my dopamine
Yeah.
hit. Like
I mean,
you take
it
my
probably
pasta,
is.
my bread,
Yeah, that's so
bread
sad.
and butter. Are you
Bread
kidding?
and butter pasta.
Yeah, she wanted me to cut gluten and dairy. I'm
Wow.
like, you literally hate me.
Oh.
Yeah. Do you want me to die?
Yeah, literally, I will die if you do that. Inject that into my, anyways. So, yeah, it literally felt impossible. And then when I started taking Vyvanse, it was like not even a question.
Yeah.
It was like, yeah, I can look at gluten and be like, I don't have to eat that.
Hmm.
And it wasn't because my appetite was curbed. It just literally was like, it felt like this big, huge, daunting thing in my brain that's like, no, I can't even fathom that. And then when I was on Vyvanse, it was like literally not even a thought. Wasn't a second thought.
Fascinating.
Well, and
Yeah.
just maybe more capacity to find gluten-free recipes or dairy-free
Mhm.
recipes
Yeah.
or whatever. Like explore more options.
Yeah.
Yes.
It didn't feel like I'm going to suffer if I don't, or like I'm making my kids lunch and like I throw a goldfish in my mouth while I'm making their lunch. It was like, yeah,
Must.
yeah. I didn't struggle with that. So continue.
No, that's really helpful. I mean, I'm sure people are in the same boat, but it's like, yeah, then you were able to be like, oh, it's just one thing
Mhm.
that I need to change and I can do it.
Yeah.
I mean, it's still not easy. Cutting out gluten sucks.
And dairy, cutting butter.
Oh, horrible.
Like, are you fun? I'm
think
sorry.
you
There's
should-
probably people that.
Are you fun? No, you're not.
I think you should wean. I don't think you should stop gluten. I think you need to wean gluten and dairy as well.
Yeah.
Oh, that's funny. Okay, so diet changes. This is going to be step one. So limiting processed foods, especially ultra processed foods. We can't, usually most of us can't limit all processed foods, but things in boxes, cans, bags, like things with a million ingredients. Those things a lot of times are designed by food scientists to be extremely like hyper palatable, and they have a wonderful mouth feel, and they're very overstimulating, and you can't rely on your own body stimuluses and hormones to tell you when you're done eating it and when you should stop. Those things are overstimulating. Sugar obviously is going to be like a main thing, and then dyes and additives and things that our bodies just aren't used to. Gluten even. So, gluten is basically a sugar. It's a carb. Caffeine. So if you're overdoing caffeine, cut that out. I know that's not really your problem. This is so interesting to me too, very specific micronutrients. B6
Okay.
is a B vitamin. And then tyrosine is an amino acid. It's actually a non-essential amino acid, so your body can create it on its own from other compounds. But those help your body make dopamine. So if you're deficient, then you could be experiencing more ADHD-like symptoms. And if you really focus on repleting them, it could, potentially help.
B6.
B6. So that's in a lot of multivitamins.
Okay.
So you can take a multi or a prenatal. You're doing that. But B6 is kind of hard to get in your diet. It's in like high concentrations in beef liver, turkey.
Oh, not getting that.
Not eating that. I mean, eggs have it. A lot of different things have it, but just, we are deficient in a lot of things. So
And can I take that while I'm pregnant?
yeah, I mean, it's in your
Oh,
prenatal.
yeah. But like if I wanted to take a supplement
More?
of it. Yeah. Because I know some people were saying B6 and Unisum to help with nausea. Did you ever try that?
Yes. and it
Okay. So I
works.
guess I can't take it. Okay.
Tyrosine, not that many people are deficient in because your body can make it. But if you're not eating enough protein, then
Okay.
yeah. So focusing on, whole foods and protein, take a multivitamin, eat things with B6 in it. And then regular exercise. So that helps to increase the dopamine and the norepinephrine in your body. It also helps to get blood flow to the brain. So I know like for kids, before taking an exam, it's really helpful. It's been shown in studies. If they jump rope or do like jumping jacks for 5 minutes before an exam, they perform better.
What? I've never
kids
heard
with
that.
ADHD.
It's
Okay,
called like a sensory diet is often prescribed, like throughout your day. What kind of movement and regulation is necessary
Why do they not have that
for adults? Great question.
For kids.
for in school?
In school.
Like,
Because our
I
school
think it's- I
program
think
is
it's
so messed
I
up.
think it's coming.
okay.
We're like little 6-year-olds sit at your desk for 8 hours.
Yeah.
And focus.
Well, I'm just thinking about Ava. Like, I think we're getting Ava tested for ADHD soon, but I see a lot of myself in her and a lot of her struggles with like academics and stuff. And I'm like, if I could just tell her, like, do 10 push-ups before
Yeah.
you.
Prioritizing sleep is going to be good. Of course, optimizing your gut health, so taking a probiotic if you need it. Certain supplements, so zinc, magnesium, vitamin D, and then omega-3 fatty acids all support your neurocognitive function. Overall, just reducing inflammation and stress as best you can. So you kind of mentioned that, like, take a minute, go outside, breathe, all of that good stuff. And then some functional medicine providers might test for, like, toxin overload, so like BPAs and heavy metals.
Okay.
Anyway, all that to say, I do think it's helpful to sometimes know extra tools and like the behavior changes that you've already put in place, like forming structure throughout your day, setting reminders, like setting yourself up for success is also helpful when you cannot take medicine or you don't want to take it for whatever reason.
No, that's super helpful. I feel like I don't hear anyone talk about this. There's like a stigma around medication. People are scared to talk about it. But I do think this is helpful for people that want to be pregnant or are pregnant and going through something similar. I have had moments where I'm like, what, is there anything I can do to help myself aside from taking medication that I can't take? Like, supplements are helpful. I didn't know any of that. So I'm curious to see, are there any of those that are not safe for pregnant women to take?
No, I think it's all good. Easier said than done, though. Like, first trimester, I just always have to say, don't expect yourself to be able to stick to any, like, habit changes. You're literally surviving.
No. Yes.
So even taking pills is hard,
yes,
right?
Yeah. So, like, if you're
gosh.
hearing this, give yourself grace.
Yeah.
Like Nina. Yeah.
But we've talked before about, I think in the anxiety episode, like, treatment begets treatment, and this, like, upward spiral that can occur. So sometimes medication is a really necessary bridge and a catalyst for these behavior changes. But when that's not an option, or if that's something you're not interested in, you're not left without anything. Like, there are still things you can pursue. But seek help. Like, I think getting a psychiatrist is huge because
First step.
Yeah, your like primary care physician just might not have like the knowledge base or resources. Even your therapist should be like referring out when it becomes outside their scope, and understanding what medications influence other medications, kind of like your season of life, what you're pursuing.
Yep.
Anything that you feel like a lot of people misunderstand about someone with ADHD, or maybe someone has misunderstood about you when you've told them you were diagnosed with it?
I just feel like and I'm speaking only really off of my experience of like when I was told that I have ADHD, what my initial thought was, and then sharing that with other people and seeing their reaction, like, oh, I got diagnosed with this, and just feeling like there wasn't a lot of empathy towards it, because I think people don't really have a true understanding of what it is. I think a lot of people just feel like, oh, you can't focus, like you're hyperactive, like that's really what the extent of my knowledge of what it was before I got diagnosed. And so just becoming a little bit more informed really helped me grow in empathy towards others and empathy towards myself. And I think I was scared at first because it's like, I don't want to be dependent on something. And I think I still have that fear in me. Like, if I take this, am I going to have to take this for the rest of my life? Even thinking about, when I'm not pregnant anymore and I'm not breastfeeding and I can have the option to take this medication, like, am I going to take it again? Or by then, will I have implemented other things that have helped me become the best version of myself? That's what I felt when I was on Vyvanse. Like, wow, I've like finally unlocked the missing puzzle piece to my brain. But yeah, I think just getting a better understanding of what ADHD is really helpful for like empathy and breaking the stigma of people that are medicated. I don't know. I think I just feel like to each their own. I am going to choose to do what's best for me, and I'm not going to judge other people's journey on how they're navigating whatever it is that they're going through, because they may be struggling with depression or undiagnosed ADHD and not choosing to, I guess, go the same route as me, but they're figuring it out, and that's okay. So yeah, I think just like growing in understanding and having empathy is important.
Love that.
Yeah, you've taught me a lot just in this one sitting.
Yeah.
Yay.
That was super helpful. Thank you for being open and sharing.
Yeah.
Everybody can find Nina, if you don't already, on Instagram.
Message me your ADHD
Tell us your
questions. No,
handle.
I'm just kidding.
Yeah.
At Nina C. Brock.
And what's
Yeah.
the name of your podcast?
I have a podcast with one little episode.
It's
About
something.
to take off.
Half an episode. It's called the Unexpected Life Podcast. Yeah.
Yes. And yeah, listen to the first episode. It's great. But thanks for being here. We
Thanks
love
for having me. I love you guys. Love what you're doing.
Bye.
Bye.